Greetings friends, it's Victor here and welcome back to another video. I am simultaneously ecstatic and also incredibly grateful to be able to say that I am now 1 year post-top surgery. Today I'm just going to kind of show you my results and also reflect back on the past year of having a flat chest, which is incredibly wonderful. But before we get started, please go ahead and click the like button and subscribe button if you feel so inclined. Thank you very much. Alright, so I guess without further ado, I will do the disrobing thing and you can see what things look like 1 year post-op. Alright, here you have it. This is my chest in its full unclothed glory. It is wonderful. I love it. I love it. I love everything about it. Yes, it is incredible. There's nothing quite like being able to just like go around the house without a shirt and feel good, and it's amazing. In August of 2020, I had double incision top surgery with free nipple grafts with Dr. Neil Zemmel in Richmond, Virginia, and this is what we came out with. First, I'll make some aesthetic notes. First, you'll note that the nipples, or at least what I see when I look in the mirror, is that the nipples are not totally symmetrical and they're not exactly the same size, and definitely like when it's cold they seem to be more the same size, whereas like when blood flow is flowing and they're a lot warmer, they tend to, like, this one gets a lot bigger than this one, I think. And so this one has kind of like this jagged, like hypertrophic scar at the edge of the nipple, which kind of has started to grow out a little bit, whereas this one is more or less just kind of like no severe scarring around the nipple. For a little bit of time there, that was kind of bothering me that they were different, but I think as I've become more comfortable with my chest as it is, I've reflected back on kind of how things were prior to surgery, and now that I'm remembering things prior to surgery, my nipples were definitely not the same size or shape then either, and so if anything, that just kind of like reaffirms to me like that this is my body, because it is doing the same thing that it was doing prior to surgical intervention. So I think that's a good thing, just in terms of like how I think about it. This nipple over here used to have a slit right down the center of it, and it kind of like it has grown back together, so it's not really a slit anymore. It was like kind of weird for a bit there, and I was worried that was gonna heal like open, but it's actually healed shut, and so it's totally normal now. This nipple tends to be like it goes between soft and hard, and this nipple, I mean, they do what nipples do, they go between soft and hard, right? But this one is a little bit squishier when they're soft. So like this one is like, I don't know, it feels like used up bubble wrap, kind of, is like a weird way I describe it, where it just like squishes a little. Whereas this one, even if it's like soft, it still has like a little bit of like firmness to it, feels like a little bit more rubbery, like a pencil eraser. Now for the actual incision scars, there are spots that are super like flush with the skin, and then parts that are definitely hypertrophic, or at least going in that direction, where it is raised above the skin, it is much more red, etc, etc. I think that overall my scars are kind of hypertrophic, and so I'm just kind of figuring out how to best deal with that and like kind of coming to terms with that and being okay with that being the case. So on this side, like this section right here is particularly raised and particularly dark, as well as parts in the inside right here. And then on this side, like this entire section is like very dark and very raised. So it's pretty bumpy. But I've got little sections like that, and like toward the center there, and like that section, and like right here, that are really flush, and like you don't really see that same hypertrophy going like all the way across, which I think is interesting. So I think it's probably to do with like how the skin stretches, like when I raise my arms and things. That's probably why it ended up the way it has. When I first got surgery in August of 2020, I was totally pre-testosterone. I started T in January of 2021, and so these are results that, you know, from surgery where I was not on T at the time of surgery. If you're interested to see my totally pre-T results, you can go back and look at older videos prior to January of 2021, and that is what that all looked like prior to T. Now I'm about 6.5 months, 7 months, something like that. I mean 7 months, 7.5 months on T at this point, and so that hasn't really affected things at all in terms of what my results look like so far. So that's all I can say about that. Who knows whether or not that will change in the future, but as of right now, I have not noticed any like aesthetic differences at all due to being on teeth. I made a whole video series that was honestly pretty long and detailed about top surgery recovery, so if you're interested in what that specifically looked like, you're welcome to go look at those. They're from about a year ago, but at this point, reflecting back on surgery and the recovery experience, I can 1000% say that it was totally worth it and that I have absolutely no regrets. Recovery was generally uncomfortable and generally unpleasant, but not like horrible. Even so, it's probably not an experience I would intentionally repeat without good reason to do so. But with that said, I would 1000% do it over again 10 times if it meant that I got to have a flat chest like I do now. In my opinion, top surgery recovery was much easier than I was expecting. I was expecting it to kind of be awful and painful and like generally really unpleasant, but it was just kind of mildly unpleasant. I did the entire recovery without any painkillers and was totally fine. I was generally mobile enough that I could do things for myself and could take care of myself for the most part. And so it was, for me, totally doable. Reflecting back on the past year of having a flat chest and being able to, you know, have my shirt off at the pool and like, you know, be able to like wear clothing that I feel like I would not have worn before is like really, really incredible. I feel like I no longer look at myself in the mirror and go like, oh, what's going on with that? Like, I look at myself, I'm like, oh, hey, Victor, this is how you're supposed to look. And that is just like an incredible feeling that like, I do not think like pre-surgery me could possibly have conceptualized, but it is just like so affirming, and I have absolutely no bad things to say about it. I feel like at this point in my life, especially being 7.5 months on T, in addition to having a flat chest, I generally present fairly masculine such that I very rarely get misgendered in the female direction, which is good because that's not something, like I never want to be gendered as female like ever. And so for me, that is a very good thing. And so, yeah, I feel like this definitely contributes to that a lot. Additionally, I feel like it's just really awesome to be able to like look at myself in the mirror and like, you know, make faces and like muscles at myself and be like, hey, like, you look good, you're taking care of yourself. It feels so much better, and it's so much easier for me to take care of myself with that like visual aesthetic reinforcement. And I realized that I don't have like, you know, the ideal like male body or like any kind of ideal body, and I don't think that that is my goal, and I don't think that that's generally a healthy goal for most people, but I do think that having the visual feedback of like seeing myself, it helps me make better choices about like what I eat and like how much or how little I'm exercising and like what types of activities I do and how I recreate and how I generally take care of my physical and mental and emotional health. I will say that that was a fairly unforeseen consequence of getting surgery. I did not realize that it would be so much easier to take care of myself because of surgery. Now, I would like to make a brief disclaimer here. I am not saying that, you know, if you're thinking about surgery and you go and get surgery, that it's going to magically solve all your problems and then you're not going to have any kind of like dysphoria or anxiety or like body image issues or anything after that. That's not at all what I'm saying, but I am saying that for me, it has helped tremendously. All right, those were just some brief thoughts, so I don't really have much more to say beyond that, except this is what it looks like 1 year post-op. It is very clearly hypertrophic. I have really come to accept that, and I think if it continues to change and evolve over the course of the coming months and years, that I will continue to adapt my mindset to really understand, you know, at what point is it a health concern? Because for me, aesthetically, I know that a lot of people like go into double incision top surgery with the intent of having as pristine looking and symmetrical and as minimally scarred a chest as possible. And I think that that has kind of created this like ideal, so to speak, of post-op results. And I think that I have, over the course of the past year, really started to unpack that a little bit for myself and come to understand that I don't need what other people are putting forth as the ideal results in order to really be happy with the results that I have. So those are just my 2 cents on that. All right, that is all I have, so I will leave you with that. I hope that you are doing well and that you have a wonderful day, and until next time.